a good number of weeks now. It seems like it may be going on to, our third year of doing this. On Friday mornings, we've been visiting with Imperial County Chief Executive Officer Tony Rouhotas, and with him today from Imperial County also is Jeff Lamoure. Good morning, Tony. Good morning, Jeff.
Good morning, sir.
Good morning.
And we're trying to keep people up to date with some accurate information as to what is going on and what's happening, and even in some respects, what we can expect as this COVID-19 pandemic continues. And we'll start off with you, Tony. First off, this week, the county health officer, Dr. Stephen Monday, moved us a bit ahead in phase 2. What exactly is going on?
That's correct. So we moved forward with the governor's orders and still within some restrictive activity, but to go ahead and open up retail stores and to go ahead and with the modified opening of religious areas like churches, areas of faith. There has been some discussion. I know some of the larger churches, I understand that initially there was discussion about 25% versus 100. However, when the governor put the orders out, he did not go with the 25%. He went with the 25% or 100 patrons, and with 100 being a max. So we probably all heard the discussion, and I've had discussions with some of the pastors and fathers of local churches that would rather see the 25% versus the 100 max, because some of their churches hold a great deal larger capacity than 100. So that is something, that will be discussed in the future. But as of right now, retail is open. It can reopen after they follow the guidelines and safety precautions that have been put in place, and the faith-based organizations reopening at a limited capacity. So that was big news, and Jeff has a lot of details. Jeff's been working with all these groups and working on the transition to ensure patron safety as well as employee safety of those facilities.
Okay, Jeff, expand a little bit on that. Exactly who is now allowed to reopen?
Sure. Good morning, Carroll. So just to recap what Tony had just reviewed, businesses that are allowed to open at this point, as Tony had mentioned, is all retail businesses, which includes the shopping mall. So the shopping mall should be gearing up. If not open today, we'll be gearing up to open the Imperial Valley Mall. In addition to that, Tony already had mentioned the religious services, but also, which has been in place for some time, car washes and pet grooming, tanning facilities, office-based businesses, outdoor museums and galleries, child care facilities are among the few that are currently open. Again, we're still in the lower risk category of phase 2. We have not had our variants. It's not at the point to be approved at this time. Just a reminder of businesses that are not allowed to open at this point in time are nail salons, unfortunately, the hair salons and barbershops. Although the governor did move that particular business sector, the barbershops and hair salons specifically, moved them into the higher risk of stage 2. So again, when we get the variants approved, or as the state moves into the high risk portion of phase 2, then those businesses will be allowed to operate with some restrictions. But nail salons currently still remains in phase 3 or stage 3. But that also still not allowed to open are tattoo facilities, gyms and fitness studios, which would include gymnastic facilities, bars, lounges, and nightclubs, movie theaters, state gaming facilities, indoor museums. Libraries are also in the phase 2 high-risk category and are allowed to open. Right now, they're in the lower risk for curbside, so the residents can contact their local library and can request books or items, and then the library can take them outside to the customer to take control of. Community centers, pools are still, our public pools are still in phase 3. Playground, specific types of playground areas, and concert venues and festivals. So these are some of the things that have been outlined that are still not at this point open. Again, this movement that the governor is doing is very fluid. Those items that are outlined on their in their recovery plan that have currently listed in phase 3, it's very possible as time goes on and within a matter of days or weeks that they could be moved over to phase 2 high risk or into the statewide move in phase 2. So we keep we continue to monitor that very closely to see what changes they make, and they do them on a sometimes if not weekly, daily basis. So that's something to keep an eye on. And we look forward to being able to move into the high risk phase 2 soon.
Okay, and being able to move is going to be a valley-wide endeavor. It's going to take you, me, and everybody else to continue to wear a face covering when you're out and maintain social distancing and wash your hands, avoid large groups. That is continuing. And you have already seen 2 counties in Northern California that opened a week or so ago have already had to pull back from that. And that's something you don't want to go. You don't want to go there.
Yeah, thank you for pointing that out. That is correct. So we need to be very vigilant with regards to as we transition into, as it exists now, we need the community. This is going to require everybody in our community to come together and to try to help minimize or reduce the spread, stop the spread of COVID. One of our big challenges is our metric in the epidemiological stage, and that has to do with our testing positivity rate. That's one of the main key metrics that we need to bring down to below 8%. Right now we're at 31%, and it's a 7-day average. So as we look at this data, as our community goes out and tests, and I'll get into testing here in a few minutes, but as our community goes out and gets tested, those individuals, obviously we want to identify those that are positive, and we want to ensure that they stay home, they're isolated, so that they can go through the phase, the 14-day time frame to get better. But those that are healthy and also are being tested, then those again get counted towards our numbers and help obviously bring that testing positivity rate down. So that's going to be key for moving on to the next phase. One other part of so we meet all the metric criteria with the exception of 2 areas. One is I just went over the epidemiological portion of the metric, and then the other is our skilled nursing facilities. Of the 3 facilities we have one that is still lacking the required personal protective equipment, PPE. They need to be able to demonstrate they have a 14-day supply. So we're working very closely with them to address that deficiency, and that should be corrected here pretty quick. So that's not as great of a concern, although we want them to have the equipment they need. But as far as a metric, we're very confident that will be quickly remedied, but it's the epidemiological portion of it that we really need to focus on. And so it's really important to get our community out, get them tested. It is open, and I might as well go ahead and jump into testing real quick. It is open. It's open to all, for anybody that wants to be tested. Our community testing site, OptumServe, we'll be moving it over the weekend to Kxo. It will be located at 707 Dual Street in Kxo at the Kxo Community Center. It will open at 7 a.m. on Monday, June 1st. But we were also approved for the second site, and that second site will be located at the Imperial County Veterans Hall in Imperial. I believe the address is 247 South Imperial Avenue, and that will be up and operating Wednesday about noon. So we are getting that facility ready at this point in time. The state will be sending nursing staff to operate it, and that will allow us that will add an additional 132 specimen collections per day to count towards our total testing capacity for Imperial County. So that's very important for the public to know. And here shortly, just in a matter of less than a week, we'll have a second testing site available to our community. So just to make sure that the public's aware of that, and that we want each and every one of our community members that want to be tested, that they can be tested.
And one of the things that it's all mathematical. In the beginning, only people that met certain criteria were being tested. Now, anybody is encouraged to be tested, and it doesn't cost anything at OptumServe. You go online, you make an appointment, or you call, you make an appointment, you get tested. And part of the math is we need far more positives to get tested. You know, for a while, the only ones getting tested, we already knew they were positive. We need more negatives, is what I'm trying to say.
Yeah, so let's clarify, because you said it in reverse at the beginning. We need more negatives to get tested than positives. So even if you're healthy, the push is to still have you go get tested.
Yes, we encourage that, and that will boost up the numbers.
That's correct.
That will correct. That will bring the numbers down. So that is correct. Right now we're, as I mentioned, at 31%. Obviously, as more and more individuals are tested, and that range between the positive test and the negative test begin to grow, with the positives obviously exceeding the number of the negatives exceeding the number of positives, then that will bring that positivity rate down. And that's the direction we need to go in order to stabilize what's happening throughout our community, to be able to demonstrate that we're stabilizing what's happening throughout our community. So yes, we would encourage all to test, and again, making that second testing site. But also keep in mind, we do have a number of providers out there as well that are also providing testing. We have testing capacity of now right a little over 400. With the second site, it will be a little over 500 tests per day, at least the capacity for that, and that also fluctuates to a higher number as well, a little bit over 500. So that's good news. So that's available to our community.
Okay. Tony, what adjustments have been made at the county level, county-wide?
So countywide, we're still pushing. I mean, we have restrictions in our own building. When you walk in, you get asked a series of health questions. You get your temperature checked before even entering. We actually have a color system where you get a dot placed on your county ID just to make sure, we're adhering to our own rules and preaching the same message. We have a lot of staff telecommuting versus inside, so we can maintain social distancing. I can't remember what the exact percentage is, but we have a large percentage of our staff telecommuting on a daily basis, and that just helps us maintain our numbers and population inside the county building as much as possible. Great deal of messaging going out. I know the field medical station began accepting patients, which is stationed out at IBC. They began accepting patients on Monday. It was all set up over the weekend. It's a pretty extravagant facility, what they did with the actual gym. But they also did some outdoor segregation areas, large tents that are air conditioned in the event that they need additional overflow. A lot of that's precautionary, but having it here and available instead of needing it and it not being here, that's a huge positive for anybody that might need that additional care. So public health did a lot of logistical work and making that happen. We have a great deal of staff that was brought in from the state and federal level to assist with the care of any patients that might go into that facility. So my hat's off to all the staff that helped put that huge logistical task together.
Okay, and we are making progress. One of the keys, again, is, as you stressed, Tony, and you did as well, Jeff, is get tested, especially if you feel good and you're going to be negative, so that we can get the numbers where they need to be, and don't let up. Wash your hands, take every precaution, and just because something is open doesn't mean you have to go there. Okay?
I would agree.
Right.
Hey, Carroll, if I can touch real quick just on, so I can speak specifically or directly to the businesses out there. Maybe you have a minute?
We got all the time in the world.
Fantastic. So just specific to the businesses. So as the businesses out there, as our retail businesses and a number of our office businesses that are beginning to move into the opening phase, One of the things that we want to do, and we're trying to make available for them, we've created some tools for them, but the important part in this, it's in the guidance documents that the state has developed for the reopening of the various businesses and the various industry sectors. One of the key things is that they need to perform a detailed risk assessment and implement a site-specific protection plan. In addition to that, they need to provide training to employees on how to limit the spread of COVID-19. They need to implement individual control measures for screening and disinfection protocols. It's very important that they mindfully go through or thoughtfully go through these processes. And so in order to accomplish that, what we have done, a number of these businesses have already, they're well ahead of the game, and they've done they've done their own research. I'm sure a lot of them have already reviewed the state's guidance document, which is specific to their business or within their business sector. But for those that are still looking into that, we have developed a worksite-specific protection plan or a worksite-specific plan, and that was in coordination with the Imperial Valley Business Recovery Task Force and the LHA, the Local Health Authority Commission. And so this plan is available on the Public Health Department's website, ICPHD.org, but also it's available at the Business Recovery Task Force on their website, and it is available at the various chambers. And it's been sent out to a number of businesses out there. I believe about 1,400 businesses or so have received this. But this plan that this document, this template that we've put together, the idea is it's a very universal document. It covers the majority of what's expected or what's required under the guidance document for the various business sectors. So if the business has not created a site-specific work plan, that they can go online and download this document. It's a simple checklist, and essentially they would check what's applicable to them. I mean, it's specific to their business, as is indicated in the title. They would check the specific sections that are applicable to them. And just to go over real quick, a couple of sections. There's the measures to protect employee health, so it covers that. It talks about business hours. They may have modified their hours, so they would identify that. They talk about universal screening if they have a program in place for that. They talk about the employees that would wear, if they have face coverings or they should wear face coverings or face masks. The various types of physical barriers, the plexiglass around in certain areas where the cashier register may be located, or areas in the foyer or the area where a customer is greeted by an employee. There may be some partitions that are put in place there. In addition to that, there is the measures to protect consumer safety. So there is the focus on the consumer, which may be there's a number of facilities, for example, the retail facilities that were approved to open on Tuesday. The rest of the remaining retail facilities, they're limited to 50% occupancy. So it's, again, going in and looking at what their occupancy limits are and then managing their business so that they're managing their occupancy levels with that. They may want to look into doing some type of, the currency is still, we talked about this last time, currency is still can be used. Coin currency or paper currency still is accepted. They're really encouraging trying to minimize contact surfaces, so going to a touch-free payment system if that's available and easily accessible for these businesses to get, then that's something they want to consider. So again, that's part of the checklist that they want to look at. There's a discussion with regards to, or focus with regards to high contact surfaces and how they would be disinfected. The placement of hand sanitizer or disinfection wipes around the workplace. Also talks about, if it's a type of business that may have carts or bags or things that they may carry, and how those will be wiped down, cleaned, and so forth. There's also a section with regards to measures to keep people at least 6 feet apart. So the social distancing, there's sections within that they would identify what's applicable to their business, and so forth and so on. So it's really important that they go through, and they need to, as part of the criteria, they need to develop a worksite-specific safety plan or protection plan. They need to have that available, and it's going to cover, it's going to assist them in 3 ways. One is, obviously, it covers the requirements under the state guidance document, but 2, it also is for the employee, so it provides the employee a level of comfort that they know that their owners, management has mindfully gone through and attempted to address all of the potential protective measures that need to be implemented to ensure the safety and the health of their employees, but also for that customer that may be coming into that business. It provides, there's going to be some hesitation for some individuals to go into businesses. Some may feel comfortable doing it. Some may still kind of be hesitant about doing it. Having this worksite specific plan provides a level of comfort to those customers that they're aware that these businesses have gone through and have assessed their business and have implemented protection measures for their safety, for their employees as well as their customers. This plan, what is required is it has to be posted in the establishment. It needs to be in a visible area. What we are also working on and should have available, I'm hoping as soon as Monday, is a poster that businesses can also download, and it's a poster that kind of summarizes the worksite specific plan. Instead of posting 7 or 8 pages on your door or in your windows, having a single poster that they can post. Again, the idea is so as customers are approaching the business, that they see this poster that identifies this worksite specific plan, that the business has addressed those key concerns, and then the plan itself can be posted back in maybe in the break room or an employee room, or maybe behind the counter somewhere. So it's still been posted, but again, it's another mechanism that the public, the employees are aware that the business has taken the proper precautions to safeguard those who come into the business. So that is very important. The other thing that we're working on, the last thing that we're working on, is also to, as businesses are working on developing these plans and they may have questions, I'll be reaching out, or I have reached out to the cities, and what we want to do is to develop a team that will be able to answer those questions. And if a business, a lot of these businesses already have gone through and have made all the adjustments. They've developed, moved desks around, moved tables around, and things like that to ensure the social distancing. They've put up barriers. They put up sanitizing stations throughout the areas, or made them available. So a lot of businesses have already done this, but there may be some businesses that are not sure exactly, or they may have some questions with regards to how to develop that or how to implement that. And so that's what this team will be for. They'll be there to answer these questions. And the idea is, again, to have it in their respective cities so that they can call upon those individuals to, if they request someone to go out and take a look at their business and can give them some kind of an overview. Again, it's not an enforcement tool or approach. It's going to be more of just a resource, and it's just per request by the public. So if the businesses call upon us to do that, we're there to provide that service. So just want to make sure businesses are aware that we're looking out for them and want to provide that service to get them in that place where they need to be so they can safely reopen.
Okay. We appreciate the visit this morning, and we've been visiting with Tony Rouhotas and Jeff Lamoure, updating the COVID-19 pandemic situation in Imperial County. And gentlemen, have a fun weekend staying at home and getting all the chores done around the house. And Jeff is working out of a bunker 300 feet below the surface beneath Heber at the County Command Center. So yeah, we're glad that we were able to establish communications.
Thank you, sir.
Appreciate it.
You guys have a great weekend.
You too. Thank you.
Take care.
Coming up, another great mix of oldies.
12:30 Kxo.